Physicians for Social Responsibility. Our program today is entitled Too Dirty, Too Dangerous, Why Health Professionals Reject Natural Gas. The topic is just what the title suggests. I'm assisted on this webinar today by my colleague, Julia Morgan, who's on the controls. Thank you, Julia. Just one housekeeping detail before we get started. We will have question and answer at the end of the presentation. I think what we'll do is we'll just open up the microphones and let people speak out, but you'll be muted in the meantime during the presentation. And this program is being recorded. So welcome again to today's presentation by Physicians for Social Responsibility. Natural gas, or methane, has emerged as a battleground in the fight to stop fossil fuels, to protect ourselves from the toxics they spew, and of course from the grave threat they pose to the climate. To provide you with more information on methane gas and its implications for health, PSR has produced a new report, Too Dirty, Too Dangerous, Why Health Professionals Reject Natural Gas. The report cites scientific studies that look at methane's implications for health. Today's presentation will highlight some of those findings. What I'm going to present today is just a portion of what's available in the full report. The report has 159 footnotes, and almost every one of those includes an electronic link to the original source, so you can go in-depth into the studies themselves. That's because we really want you to use this report as a resource that strengthens your work to identify methane gas as a severe threat to health that belongs in the ground, not in our air or our water. I hope you'll use the report plus this webinar to help make that case in your community, to your colleagues, and to decision makers. You'll find the report on the PSR website. I'll give you its URL at the end of this presentation. Next slide, please. I'd like to begin this conversation kind of at the end. The future of energy production and the future of our lives on this planet lie in clean, renewable energy sources, things like solar, wind, and geothermal, and in energy efficiency. That's for several reasons. Renewable energy sources will protect us from climate change. They emit virtually no heat-trapping greenhouse gases. They're essentially free and everlasting. They basically eliminate the need for mining, except, of course, for initial manufacture. They mean no fracking. They mean no post-combustion toxic waste like coal ash. And the result of that kind of energy system is much cleaner air, much cleaner water, and much better health for people everywhere. Next slide. If we keep buying and burning fossil fuels, we won't get there. That's a particular concern right now, as many utilities are moving to replace our dwindling supply of coal with natural gas or methane. But that's the wrong reason. That's the wrong direction for us to go. Next slide. There are a number of problems with natural gas. A large and growing body of scientific research documents that natural gas causes serious problems. So today's presentation will show in what ways natural gas is too dirty, especially in regard to fracking, and too dangerous, especially in regard to climate change and the ways that it endangers health and survival. Next slide. I'm going to assume that you're fairly familiar with the basic fracking, the basic process of fracking, or hydraulic fracturing, which is used increasingly to extract methane from deep underground layers of rock. It's a complex process, and it impacts local communities most heavily. It brings heavy industrial equipment and processes, often into rural areas. It entails huge numbers of truck trips. It uses and contaminates millions of gallons of water, and it contaminates the air, the water, and sometimes the land with its toxic chemicals. Some of the toxic substances associated with fracking are then transported far from the well site by pipelines and associated infrastructure. Next slide. In the fracking process, a complex blend of chemicals is mixed with literally millions of gallons of water and then forced underground under high pressure to fracture deep underground layers of rock. We know that some of the substances in fracking fluid are toxic or cancer-causing or endocrine disrupting, as the slide says. Fracking fluids can contain petroleum distillates, This can be benzene, ethylbenzene, toluene, xylene, the BTEX complex as it's called, as well as others. Polycyclic aromatic hydrocarbons, formaldehyde, ethylene glycol, that's antifreeze, sodium hydroxide, and more dangerous chemicals. Very, very small quantities of some of these chemicals can contaminate millions of gallons of water. Benzene, for example, the known human carcinogen, is toxic in water at levels greater than 5 parts per billion. Benzene and toluene are also volatile organic compounds that can be found sometimes at levels exceeding drinking water standards. And besides being a health threat in the water, they readily go airborne. That's what the volatile part is, creating threats from inhalation. Endocrine disruptors are chemicals that may interfere with the body's endocrine system and produce adverse effects in human development, in the reproductive system, the nervous system, and or the immune system. That's a little bit of what we know about fracking fluids. There's a lot that we don't know. In many places, drilling companies are not required to reveal what chemicals they use in their fracking fluids. It's proprietary business information. It's a trade secret. As a result, when people are exposed to fracking fluids, and that could be workers, it could be the truck drivers carrying the chemicals, or the people who live right there where fracking is taking place, they won't necessarily know what they've been exposed to, and in that case, doctors won't know how to treat them. And as I mentioned, these chemicals contaminate the millions of gallons of water that are forced underground during the fracking phase. Where the wellbore passes through natural underground water reservoirs or aquifers, there's the danger of contaminating that underground water supply if the wellbore cracks or if it breaks. And then 30 to 40% of the fracking water forced underground is brought back up to the surface where it becomes its own toxic problem above ground. Next slide. When those fracking liquids, the water and the chemicals, are brought back up to the surface, they can bring with them naturally occurring substances that are really better off staying deep underground. So that wastewater can contain salts, radioactive materials like radon, heavy metals, polycyclic aromatic hydrocarbons, which are anticipated to be a human carcinogen and can affect the liver, skin, and immune system. And I'll tell you more about volatile organic compounds on the next slide. Next slide, please. So the most common air pollutants from fracking seem to be VOCs and particulate matter. VOCs, as you can see on the slide, are emitted across the natural gas supply chain. That means from the point of extraction to the end user, and can cause cancer, can affect the nervous system, can cause birth defects. You'll hear more about that later. They also contribute to the formation of ground-level ozone or smog, which can cause irreversible lung damage. Particulate matter is emitted primarily by the trucks and diesel motors that are used in fracking-related processes. Trucks with diesel engines are used to transport the supplies, the huge amounts of water, and then the waste to and from the gas wells. They can make between 40 and 280 truck trips per day per well pad during the development phase. Generators equipped with diesel engines are used both in drilling the wells and in the hydraulic fracturing itself. Particulate matter is not a single substance. It's actually tiny particles of varied chemical composition that are inhaled into the body. They can go deep into the lungs. The smallest particles can actually go into the bloodstream, which is why they cause such a variety of serious impacts on the human body. And long-term repeated exposure is associated even with death. In extreme cases, VOCs and particulate matter can both increase the risk of premature death. Next slide, please. A lot of the material I've just gone through, and I went through it quickly for this reason, you may very well already be familiar with. What I'd like to do, and what PSR's report does, is to highlight some of the specific scientific studies that document what we know about fracking and about natural gas. So, and you'll see on this slide and on some of the ones that follow, I have included some of the citations so that you can get a quick indication of what the sources are and how high quality and reputable they are. Most of the sources that we cite, as many as possible, are peer-reviewed journals. So volatile organic compounds, as I was just saying, can form ground-level ozone. Volatile organic compounds and ozone pollution are often high in urban areas where they're emitted by cars and trucks, but they've also been detected at dangerously high levels at fracking sites, even in rural areas that are not usually associated with air pollution. The first study that I cite looks at Utah, home of one of the highest producing oil and gas fields in the United States. Out in rural Utah, it's actually dinosaur bone territory. They've experienced dangerously high levels of VOCs and ozone at levels similar to those in Los Angeles. A study by the University of Colorado, Denver, Denver School of Public Health documented dangerous airborne levels of benzene near hydraulic fracturing operations, as well as elevated risks of cancer for residents living nearby. And ambient air testing near gas drilling operations in northern Texas found excessive amounts of benzene and of carbon disulfide, which is an extremely high-risk pollutant with disaster potential, as categorized by the Texas Commission on Environmental Quality. Next slide, please. What I was just describing are risks, levels of dangerous substances at dangerously high levels associated with fracking. What we need to let the world know is that recent studies show associations between living near fracking sites and actual outcomes, not just risk, but people actually getting sick. So here are two of the highly reputable studies that present evidence indicating that if you live near a fracking site, it can increase the likelihood that you will experience a serious health effect. And I'm going to go into a little bit more detail about these studies again, because I think that these are the specific pieces that are closest to a smoking gun. It's really important that we understand them and are able to talk about them and share them with others. So 2015, a study by University of Pennsylvania and Columbia University researchers found a statistical association between well density and increased rates of hospitalization for a variety of conditions, including cardiac and cancer-related conditions. So statistical association, the greater the well density, the greater the rates of hospitalization. The researchers correlated databases on hospital inpatients against a map of active fracking wells for gas and oil in 3 Pennsylvania counties. One of the counties had no fracking activity. That was their control county. The other 2 had fracking activity that actually increased during the study period. They looked at over 92,800 patient records. That's one of the strengths of this study, that had such huge database. And what they found was association between well density and increased rates of hospitalization, again, for the conditions listed on the slide. In the communities with the most wells, the rate of cardiac hospitalizations was 27% higher than in the control county. Now, I will note that the researchers themselves stated that further studies are necessary to determine whether specific toxicants or combinations are associated with organ-specific responses. In other words, these statistical associations are very important, they're very telling, but they're not statements of cause. The other study that's cited on this slide was done it was published in 2016. And here the researchers identified a statistical association between progressively worsening asthma symptoms and the patient's proximity to natural gas operations, fracking operations. The study looked at the electronic health records of over 35,000 patients with asthma, again, a very robust database. And then they studied 4 different phases of the fracking operation, as well as the distance from the patient's home to the well characteristics, the dates and durations of the phases. And then they compared these metrics, again, to the asthma symptoms, and what they found, statistical association with increased risk of asthma exacerbations, ranging from mild, which was people needed a new medication order, they needed new corticosteroids for their asthma, to moderate, which means they went to the emergency department, to a severe exacerbations, which means hospitalization. Once again, the study noted that although these were clear associations, they did not determine whether the associations are causal, that is, whether it's the proximity to a fracking site that caused the asthma exacerbations. but given how prevalent asthma is, how potentially dangerous it can be, and how these cases are taking place in rural areas, I think this is really significant data. Next slide, please. Once again, more information on actual health outcomes. In 2014, there was a study of almost 25,000 births, and researchers again found a statistical association between serious birth defects and the density and proximity of natural gas wells to where the mothers lived. This is a study that was conducted in rural Colorado. It deliberately excluded towns and cities of over 50,000 people so that it reduced the likelihood that the pollutants that were involved might have come from other sources. And what they found in terms of associations, the strongest association they found was between density and proximity of natural gas wells within a 10-mile radius of the mother's residence and the prevalence of congenital heart defects. I just want to say a word about birth defects. Birth defects are a leading cause of neonatal mortality, or in non-medical terms, the deaths of newborn babies. Many of these defects are thought to result from interactions between genetic and environmental factors. So the suspected non-genetic risk factors for serious birth defects include deficiency of folate, maternal smoking, alcohol abuse, no surprises there, and exposure to benzene, toluene, polycyclic aromatic hydrocarbons, and petroleum-based solvents like aromatic hydrocarbons. That list of air pollutants should sound familiar. They're emitted during the development and production of natural gas. The 2016 study, published just last year, a statistical association was found between expectant mothers living in the most active fracking areas and increased risk of high-risk pregnancy and premature birth. So this study examined electronic health record data from over 10,000 births in North and Central Pennsylvania. Then they looked at information about fracking wells and, again, how close the wells were to the homes of the pregnant mothers, as well as what stage of drilling they were in, how deep the wells were dug, how much gas was being produced at the wells during the mother's pregnancies. Really, really fine-grained information. So using this information, they developed an index of how active each of the wells were and how close they were to the women. And they found that expectant mothers living in the most active fracking areas were at 30% greater risk of high-risk pregnancy and 40% more likely to give birth prematurely. Premature birth is the single greatest contributor to infant death. According to the CDC, the U.S. Centers for Disease Control and Prevention, premature birth accounts for 35% of all infant deaths, or more than any other single cause. That was in 2010. Being born prematurely is also a leading cause of long-term neurological disabilities in children. Once again, this is not a causal study. The study does not state why the pregnant women had worse outcomes near the most active wells, but the outcome itself is very, very evident. Next slide, please. So that's what we mean when we talk about fracking being dirty. Not only are there dangerous chemicals used, not only are those chemicals evident in the air and water, but we really have evidence now of people getting sick. Obviously, that kind of dirty is also terribly dangerous. But I'm going to talk now about danger in terms of methane's effects on the climate. Methane is a greenhouse gas like carbon dioxide. However, it's far more powerful at trapping heat. The good news is a methane molecule in the atmosphere lasts only 12.4 years. The bad news, it breaks down after those years into carbon dioxide and water vapor, both of which are, guess what, greenhouse gases. So although the methane no longer exists as methane, its breakdown products extend methane's impact on the climate for decades. So over 20 years, methane is calculated to be 86 times more potent at trapping heat than is carbon dioxide, according to the Intergovernmental Panel on Climate Change. So let's think about the next 20 years. The next 20, or maybe if we're lucky, 30 years, are expected to be decisive in determining climate change impacts. That's because of tipping points. We're approaching a critical threshold, a greater than 2 degrees Celsius temperature increase over pre-industrial average temperatures. If we pass that threshold, scientists think the following things will happen. The Greenland ice sheet will melt. That will cause significant sea level rise, endangering coasts around the world. It will also expose more dark ocean waters, which of course absorb more heat, contributing to further climate change. The Amazon rainforest will face lengthening dry seasons and droughts. If the rainforest reaches its own tipping point, we can see dieback of up to 80% of the rainforest, meaning the loss of a gigantic carbon sink. And much of the world's permafrost will melt, releasing vast amounts of carbon dioxide and methane from that soil, which normally remains frozen. This would yield even greater climate change acceleration. So we have all of these outcomes that just hasten the process that caused them. And parts of the world would reach unlivable temperatures. That's the climate crisis, and that's what we need to avoid. So that's why when we talk about methane, it's urgent that we look at methane's warming impact over this critical 20-year window, and that has to determine the actions that we take. The next slide, please. So one of the things about methane and fracking operations and our subsequent transport and use of fracking is that methane leaks. It leaks throughout this system or life cycle of methane. It leaks starting with the wells. The concrete, as I mentioned, the concrete that makes up the wellbore can crack and leak. The equipment on site can leak. The infrastructure can leak. We also find that a certain amount of natural gas is actually released deliberately at the well site. This is called venting. Sometimes gas is vented in the early stages of extraction when the early drilling is going on, but the processing equipment isn't up and running. Venting also occurs from the compressor stations that push the gas through the pipelines on its way to delivery. There, the venting serves to reduce pressure buildups. The good thing about deliberate practices like venting is that they can be brought under control, and there are regulatory efforts to require the fracking companies to tighten up their operations so that there's less venting and even less leaking. Leaks, of course, can be accidental, not so easy to control. Next slide. There's another source of leakage from fracking and other drilling operations, and that is leakage from abandoned wells. I thought that the number of abandoned gas and oil wells was positively astonishing. It's estimated at 3 million. Who knew? Many of them leak, as you can see on the slide. Some of them leak immediately. Half of them leak after 15 years, more than that after 30 years. So as the years go by, the number of wells that leak, the number of abandoned wells, increases. At a time like now when we have a fracking boom, that's a number that's going up and up. And there are no EPA or other nationwide controls on leakage from abandoned wells, and in the current regulatory or anti-regulatory atmosphere, less and less likely. Next slide, please. I also wanted to mention pipelines as an important source of leakage, specifically compressor stations. So pipelines carry the methane from the well site to the utility company that's going to burn it, or sometimes to a port facility for export. These pipelines can be hundreds of miles long, and about maybe roughly every 50 miles there's a compressor station that keeps the gas pressurized and moving through the pipelines. A study conducted in the Texas Barnett Shale found that methane emissions from compressor stations were substantially higher than those from well pads. That's the citation on the slide. Storage facilities can also leak, as we saw from the massive month-long leak at the Aliso Canyon facility in California. That leak lasted from October of 2015 to February of 2016. And according to the director of California Oil and Gas, quote, "It was a mega leak, one of the biggest ever recorded." And then finally, the pipelines that carry natural gas from the well site to the utility company and then from the utility company to your home, they can also leak. Next slide, please. So leaks actually have been detected in several major cities, from the distribution pipes that run under our streets and up to our houses. There were several studies conducted in Boston looking at methane leakage from distribution pipes. One of these studies conducted in 2015 found that methane emissions from distribution pipes and end use were 2 to 3 times greater than had been predicted by industry. The authors noted that areas that consume natural gas, as distinct from those that produce it, may represent areas of significant resource loss. And their estimate was that the methane escaping during transmission, distribution, and end use averaged at between 2.1 and 3.3%, which, as you'll see in a moment, is a really significant amount. Next slide, please. So this is a really important question. How much is leaking overall? And it's not a question that I can give you an easy answer to. It's hotly debated. There was one source published in October of last year, quite recent, that cited varying researchers' estimates of leaks across the supply chain that ranged from 0.2% to 10% of produced methane. That's quite a range. There was a pretty robust study in 2014 that used satellite data to quantify leaks, or what they call fugitive emissions, from the Eagle Ford and Bakken Shale foundations in Texas. It estimated their leakage rates at roughly 9.1 and 10.1% respectively. And in passing, the study noted that those rates of leakage call into question the climate benefit of actually using natural gas at all. At the high end of leakage estimates is Cornell University researcher Robert Howarth. He calculated that in addition to the leakage at the point of extraction, when you add in transport, storage, and distribution systems, they add about a 2.5% emission rate. This led him to conclude that on average, about 12% of the methane produced by fracking is lost by leaking into the atmosphere. While the rate of methane leakage continues to be debated, the trend that I saw in looking at research findings over the past maybe 10 years is trending towards higher, not lower, estimates of rates of leakage. So then we have to ask ourselves, and by the way, yes, that's a kitten on the slide. I put that on because you guys deserve it. I know that I'm throwing a lot of information at you, but I think it's important information. How much leakage can the planet absorb without driving us to a tipping point? Again, this is something that is debated. Different researchers have different views. Of course, how can we know? Only in the worst possible way. It was estimated in 2012 that the climate benefit of switching from switching from coal-fired to gas-fired power plants could be achieved safely only if the total natural gas leakage is below a threshold of 3.2%. And Howarth, again, he's the kind of high-end estimate guy, in 2014 proposed a comparable, if slightly lower threshold of between 2.4 to 3.2% leakage. To achieve those rates, the natural gas industry would have to attain far greater levels of methane capture or leak repair or phase out of venting and other methane emitting techniques than they're now practicing. Unfortunately, we don't really see that happening, certainly not enough. And the current administration and Congress are moving to remove regulations from the oil and gas industry on these very things, on methane leakage. This raises real questions about how we're going to control methane emissions. Next slide, please. So as we look at what's happening in the field of electricity generation today, and as I said at the beginning, this move to replace coal-fired power plants with natural gas burning plants, we ask ourselves, which of these is better, fuel or natural gas? Which one will create less warming of the planet? Once again, scientists disagree. And that's not surprising. It's a very complicated kind of estimate. The time frame matters, of course. Remember, methane is very terribly potent at trapping heat over its first 20 years in the atmosphere. Its potency declines gradually as the decades roll by. Other assumptions about things like leakage rates are going to matter. And of course, so do our expectations for industry regulation or industry self-improvement. The report, Too Dirty, Too Dangerous, cites a number of studies if you want more details on the scientific debate. But I think there's a very different takeaway that is really essential, and that is that choosing between gas and coal is not our only choice. Both of them are fossil fuels. Both of them emit dangerous conventional pollutants as well as contributing to climate change. And we have much better choices for our energy future, including wind power, solar energy, geothermal heating, and of course, energy efficiency. Next slide. One of the things we have to remember about natural gas plants and burning methane is that we can't look only at, well, we certainly can't look only at how clean the gas burns at the end of the process, because we've already seen how dirty the process is. We've seen how badly it threatens climate change. But here's the other thing. To opt for methane is to block the clean energy future. A natural gas-fired power plant is expected to have a lifespan of about 40 years. Well, that's too long, because what it means is that we're extending fossil fuel use over 40 years into the future at a time when we could be transitioning to an entirely new energy system. It delays the introduction of wind, solar, geothermal, and other options. It means postponing this absolutely vital transformation. Next slide. And this is the slide I'll end on. The choices that we make today about natural gas are implicitly choices about when and how quickly we transform our energy system from fossil fuels with all the harm that they entail to renewable energy and energy efficiency. Energy sources like wind, solar, and geothermal offer virtually no greenhouse gases, no burning or mining except for initial manufacture and transportation, no post-combustion toxic wastes like coal ash. We don't have to keep buying fossil fuels, which are only going to get scarcer, harder to mine, and more expensive. Sunlight and wind are essentially free. And all of these things mean much better health. It means much cleaner air, much cleaner water, no emissions hotspots for environmental justice communities, a much more livable planet. We need to make a choice, and the choice is clear. PSR rejects natural gas. We're opting for the future that's cleaner, healthier, and sustainable for ourselves and our children, and we hope that you'll join us in working for this future. That's our presentation for today. Thanks for listening. We'll take questions in just a minute. First, I just want to mention one more thing. This is the debut performance, if you will, of this PowerPoint. We hope to be presenting it a number of times more in the future for specific audiences in different parts of the country and for different organizations and coalitions. I'd love to have your input on this PowerPoint. I'd love to know, was this useful to you? And do you see it as being something that would be useful in your community? I also want to ask, who is your community? So is this a PowerPoint that you would show to doctors and other health professionals? Is it a PowerPoint that you would show to your neighbors at the local library? I'm trying to figure out what's suitable here for whom and how this slideshow can be made more useful, possibly made into different versions or varieties. So I'm going to send out a brief survey to get your feedback. Watch for it in the next several days. I'll be getting it out by email. So Julia, if you could take our audience off of mute, and let's just open the gates and people can kind of call out your questions. If it's chaotic, we'll work with that. Any questions or comments? Okay, we seem to have a number of people speaking at once. So why don't we, if you ask a question and you're on the West Coast, why don't you repeat your question? Do we have anybody from the West Coast with a question?
Can you hear me?
You know, folks, oh, I just heard somebody said, can you hear me? That was the first person I was able to hear clearly, so please go ahead.
Yeah, Mike Martin. I was saying that you mentioned that abandoned wells leak methane over time at an increasing rate, with those that are oldest releasing either the most or most of those wells are leaking. I was just wondering whether this might be something like lead in paint, where we used it, but then and then decided not to use it any further. But it's still a burden on society for many years to come, and a huge cost in a lot of ways for society, both in terms of health of people and in terms of having to remove it from places.
Well, that's a really interesting observation. I hadn't thought of making that comparison. It certainly is, if you will, a terrible legacy left behind by processes. And, you know, maybe the process, maybe we were more innocent or more ignorant at the time when we engaged in those processes. Yes, we are stuck with these really serious negative health legacies. The good thing is that now we know, and just as we phased out lead, it seems to me it means that we need to phase out methane. Another question?
Barb?
Go right ahead.
This is Michael Belmont. I'm in Colorado. And I do appreciate your slideshow, and I certainly and my group, our Health, Our Future, Our Longmont, which has been at the forefront of anti-fracking in Colorado since 2012, but is excellent, and it's a good overview for people, including physicians. So we would use it, which leads to the question, is this something that is accessible to us at this point, or are you ready to share it in its current form?
Thank you for those kind words. I'm glad to hear it seemed useful to you. I was actually thinking that I would wait until I got the survey and see what a more general assessment is, but we will be putting it up on the PSR website soon. Let me suggest maybe next week.
That's good. Too bad I'm testifying tomorrow at the Capitol in Denver for a bill that's proposed to increase to 1,000 feet from the property line for schools for any oil and gas activity. And you had lots of good references to children, and particularly asthmatic studies that show a huge spike in asthmatic, particularly in young people, and even cancers, leukemia in particular. But that's okay. It'll be great. We'll look forward to seeing that when it comes out.
Anybody who's testifying tomorrow gets first priority. You'll see on this final slide the URL for where you find the report electronically. So it's psr.org/resources/toodirty-toodangerous.html. I'd encourage everybody to go to the report electronically rather than waiting for the slideshow, especially if you have a specific need. And I say that because the report has not only has a lot of footnotes, it has electronic links to the source material. And so the report the written report offers very, very brief, 1- and 2-line summaries of the reports. But if you're using them for testimony, I'd urge you to go straight to the source, and the report enables you to do that.
I actually pulled it up during your presentation. Thank you.
Thank you.
Hello?
Go right ahead.
Thanks. My name is Diana Stradlow, and I'm actually in New York State. We're in the process of fighting a fracked gas pipeline that would bring up gas from the Marcellus Shale of Pennsylvania for export into Canada. And it crosses quite a number of streams, 192 streams and a sole source aquifer on its way up. And we've been trying to figure out if the gas leaks, this fracked gas leaks into streams and waterways, the impact of that.
Well, let me just make a few broad observations. That's, of course, a really hard question to ask. So we have seen at fracking sites where there is underground leakage that methane does get into both underground water and well water and eventually into people's homes. I think there's relatively little study of what chemicals might appear or occur in people's well water. Where you're talking about stream crossings, there's always, of course, the danger of breakage, cracking, or rupture of the underground pipes. But you also have a moving body of water, and so very hard to detect, I think, what would come into the stream water if it's coming in small quantities. So I don't have a ready answer for you. I'm wondering if there's anybody else on the phone who might have more expertise than I and would be able to offer Diane some suggestions.
This is Kathy Nolan with PSR New York. I don't think we have an exact answer to that question. I've spoken with Dave Brown down in Pennsylvania about this question, and he's a toxicologist and thinks that the main problem with the pipes is the scale that accumulates over time, which would have in it toxic compounds, including potentially radioactive compounds. The stream crossings, as far as I'm aware, the main problem with them is the construction aspect and the forest fragmentation and the other direct harmful physical impacts on the streams. The gases in the pipe theoretically would be lighter than air, I think. I'm kind of just thinking back to my chemistry here. And so I think you'd have to have probably pipes falling into the stream and getting that scale into the stream rather than just a leakage situation to get much water contamination that way. But if somebody else has more experience or knows differently, I would yield to them. That's just kind of reasoning it through.
Thank you, Kathy. Anybody else?
Go
ahead.
Yes. Just to be fair, are any polluting chemicals used or released into the environment in the course of manufacturing solar or wind energy equipment? That has been pretty typical in all manufacturing processes, and I'm just wondering to what extent this happens in the course of manufacturing clean energy equipment.
That's a fair observation. I don't doubt it. I don't have any specific, and certainly not any quantified information on how much that happens. But it's true when we are building, whether we're building windmills or whether we're building solar panels, there's going to be mining, there's going to be manufacturing, there's going to be transportation. Certainly in the case of windmills, of heavy equipment. I know that solar panels use rare metals, and that the mining processes for those rare metals may be particularly dangerous and damaging. So you're right. It's not an entirely black and white, good and evil kind of situation. However, I think in these situations we have to ask, well, how do these things measure? How do they balance out relatively? And I think in that case, where we're only talking about manufacturing and transportation at the very beginning of the life cycle or the supply chain for the energy, and where you can have decades and decades of generation from wind or from solar panels without the need for additional manufacturing or additional transport, and where you're not mining, and you're not burning. And let's keep in mind the combustion, because I think the combustion of fossil fuels is, especially in the case of coal, not so much in the case of methane, is another egregious source of contamination. So I think that although your point is well taken, I think that the balance tilts very, very heavily towards much greater damage to the environment and to the climate on the part of fossil fuels than from clean energy.
Thank you.
This is Kathy Nolan again from New York. I wondered in the section of the talk where you showed the statistical associations of proximity to fracking activity and density, whether it might be valuable to add at least a little bit about the observations of some people. The only ones I think that are published are Michelle Bamberger's veterinary observations, but some published observations that when people move away, or in her case, when animals are moved away from a fracking site, that they have reduction in the symptoms that they thought were associated with the fracking activities. So I think we're lacking so far in having good published material about that, but it seems to me to be one of the elements that ties down for me as a clinician the causal connection here. If you're exposed to the toxin and you get, or in this case, the activity, and you get new symptoms or worsening symptoms, and then you are removed from that, or if you could remove the activity, you get better, that's a pretty good causal demonstration.
Thank you for sharing that, Kathy. Do we have any more questions?
I had a comment on clean energy slide. Can you hear me?
Yes, indeed. Go right ahead.
You might be able to put on that slide or on another slide a very summarized capsule picture of the increasingly competitive character of a solar, wind, as compared to natural gas price. Renewables are becoming cheaper, and for example, grid-scale storage is now competitive in price with gas peaker plants. So an addition to your list of benefits of clean energy might be that it's less expensive.
That's fair enough. You know, there are a lot of good things that we could say about clean energy. I stuck the word affordable up there, but you're right. I said nothing to document that it's actually true. If I think affordability is well, first of all, so it's not PSR's forte. It's most important for PSR to be presenting the health case. We do have some data on cost, and maybe I should include some of it. I will observe both that costs are somewhat, cost for renewable energy, somewhat variable from place to place, and still not entirely affordable for lower income people, although there are things like community solar, for example, that make it more affordable. But thanks for the observation. I'll see if I can squeeze some of that in.
Yeah, it's Mike Martin. I just want to emphasize that point. Renewables really are getting to be very competitive in many situations, less expensive than gas-fired power plants, certainly than coal. And I think it's an extremely important point that, and renewables are becoming less expensive all the time. The cost of panels is going down, the cost of installation is going down, the cost of these other methodologies of coal, nuclear, they're all going up. You know, so I think that's a very valid point that should be emphasized.
Okay, I hear you. When I send my my little questionnaire or survey around, if anybody has specific recommendations like that, and especially if you have source materials that you think we might want to rely on, please be sure and add them into your survey response. We have time for a couple more questions. Do we have any more questions
Yes.
or comments?
This is Pramila Mullet. Can you hear me?
Yes, go right ahead, Pramila.
Right. So I had a couple of questions actually, and a comment which I posted in the chat, but I looks like you're not seeing them. But given the information that you cited, is PSR willing to take a clear and unequivocal position that building any new gas-fired power plants is bad for public health?
Let me think if there are any little loopholes in what you're suggesting. I would, we've certainly taken a position to ban fracking, and we anticipate in the coming months to be working to fight against any new natural gas-fired power plants. So I can't think offhand why we would not make such a statement. We'd have to draft the statement, and it would go before our board, and they would vote on it. But I can't, off the cuff, think of any reason why we wouldn't. Are you suggesting that that would be a helpful tool to have?
It would be extremely helpful. I represent a community that is in the process of fighting a brand new fracked gas power plant. So a statement from an organization with as much credibility as yours has would help us quite a bit. And also that there are 300 new gas-fired power plants being proposed around the country today. And that means that we are all going to be encircled by gas infrastructure pipelines, compressor stations, metering stations throughout the country. And I think that we all realize that that's completely untenable. So yeah, I think this statement is needed quickly, and I think it needs to be distributed widely, because the irony for us is that we are under siege by gas infrastructure, and it's all being done under the name and pretext of fighting climate change. And that is a horrible irony to have to live with when your children are being poisoned in the process. The other thing is, I'm sorry about that, can you, I don't know if you mentioned this because I joined it a little late, but can you talk about the health impacts of the Aliso Canyon leak in California? Because a lot of those impacts that were identified were very similar to what is experienced near fracking wells. And I was wondering if anyone identified what could be common culprits, and are there any ongoing studies of the impacts in that community?
Oh, that's a really good question. Just to take the last point first, I don't know about ongoing studies because all I was looking at were published studies, and not only would that not be the ongoing ones, but there's such a long lag time. Often, if you want to rely heavily on peer-reviewed, journal-published articles, there's a real lag time. I did see. I mean, there was a study in California of the. There was identification of certain of the chemicals that came out of the Aliso Canyon plant. I would have to pull that up. I don't have that at my fingertips. It was not a complete match with what we are commonly familiar with in regard to fracking plants. But I'll be happy to get back to you with further information.
Yeah, that would be great. And on the issue of cost, I think it would be great to have a cost-benefit analysis comparing the cost of health impacts emanating from the use and exposure to gas infrastructure versus the health and cost benefits and savings of using renewable energy sources. I think that would be very a useful comparison.
Yeah, you're right. That would be a useful one. We've thought about trying to find the right researcher who could produce that for us. Thanks for the additional push in that direction.
Say, Barb.
I think we have time for, yeah?
I'm sorry, Michael Belmont. Once again, from the woman's comments just a moment ago concerning the gas-fired utilities, if you are for banning fracking, you by default must be against the utilities, because if gas-fired utilities proliferate, it not only assures the continuation but the growth of the fracking industry and domestically. And if you succeed in anti-fracking, then there's no product for them to, no fuel for them to power those two, except to import it, which is worse than ever. I mean, that would cost us ruinously. So I would encourage you to immediately go on record as opposing those utilities.
Okay, thank you. I think we have time for one more question. Do we have anybody?
I've been trying to get in here for a second. Can I just get a comment in?
Go right ahead. Mm-hmm.
Thanks. I just wanted to point out when you were talking about pipelines before that one of the things we're dealing with here in Pennsylvania is natural gas liquid lines that stay a lot closer to the ground before they go into the air, as opposed to a natural gas line that would just immediately, if it leaks, send gas straight up into the atmosphere. So, so that's a big issue for us here, that we're having these pipelines like Mariner East pipelines from Sunoco to deal with that really stick close to the ground. And I also wanted to mention, pertaining to the last speaker, that we did a right-to-know request of our DEP here in Pennsylvania after the Clean Power Plan provided a loophole for the building of new power plants that would be exempt from the plan, and we have 47 new natural gas power plants already approved by our DEP. So I wanted to encourage that same ban as others were asking.
Okay, right.
Yeah,
Can I add one thing?
It's very true. Mm-hmm. Please.
Hi. In addition to power plants, it would be great if you could say no new natural gas infrastructure, including pipelines, compressor stations, et cetera, because I think people are fighting all kinds of gas infrastructure around the country.
Yes, as we are. And absolutely, yeah. The statement would be comprehensive, and I'm appreciative of Michael Belmont's comment that if you're fighting fracking, if you're opposing fracking, then of course the intention is to cut off the supply. So by implication, of course, we don't want the demand as well as we don't want the supply. Well, this has been very rich and very enjoyable. I've really enjoyed it. Thank you so much for your observations, your questions, and your encouragement to PSR to step out and make our voice better heard. We certainly intend to be working very intensively on methane-related issues, on the whole spectrum of methane-related issues in the year to come, and probably for several years. I suspect I'll get to know a number of you over the course of the years. Don't hesitate. You see my email is on the slide. Don't hesitate to email me. Don't expect an immediate response. I'm sorry, but my inbox is a disaster. But do go to our website and look at this report, use this report, and use this report as a springboard to go to the original sources, because again, it's a very brief introduction to a very important topic. Thank you all. It's been a pleasure, and have a good rest of your day. Bye.
Thanks for your good work.
Thanks a lot.
Thank you. Thanks a lot.